The way that you formulate the hypochlorous acid with active skin repair is very different than maybe other things on the market.
It's such a great molecule. So if you're using it, there's so many different ways to use. There's literally 100+ peer-reviewed scientific articles on how the product works.
How would somebody with acne use active skin repair?
So we have both a spray and a hydrogel. We want a kind of more targeted treatment. The hydrogel is great.
People that are looking for non-toxic swaps, like they're going to start using active skin repair instead of what can it replace?
Clear out that first aid medicine cabinet. Sunburns and bug bites. People are like, I'm blown away.
Justin, welcome to The Art of Being Well.
Dr. Cole, thank you for having me.
How was the flight out here? Was it unremarkable?
Unremarkable, yeah. I was just telling you I have a 3-year-old daughter, so being able to sit and just read for a few hours in quiet is it's not terrible. So it was uneventful.
Can get contained. Yeah, you have nothing else to do but just be still and quiet. Yeah, I remember those days of toddler land. It's some reprieve is nice. How do you have a airline of choice? What do you prefer flying when you go across the country?
I don't know if it's by preference. It's just American Airlines has been the one that I used to travel for in my previous careers a ton. And so I built up all my miles on them. I actually was US Air before American Airlines.
Yeah.
I remember US Air.
Oh, yeah.
Yeah, I stick with them, and it seems the best.
Yeah, US Air actually used to have a hub here in Pittsburgh back in the day, way back in the day. What a weird question. You come on a wellness podcast and ask you about airlines. I've been traveling the reason why I'm asking is I'm traveling so much for work. We see telehealth patients during the week, and typically speaking, you mentioned knowing Jenny Urich, 1,000 Hours Outside, Alex Clark. These are friends of mine. We normally see each other on an odd weekend at an event. But I've been thinking a lot of the different airlines and the pros and cons of each and all of that. Anyways, so I'd be curious to get your background, like how you have such an amazing product. It's a game changer in skin health. We're going to get into it on today's conversation, but I want to know what precipitated it? How did you get here?
Yeah, it's a kind of weird journey. One of my first jobs out of school was a product manager at a regenerative biotech company. So we made really expensive dermal engineered skin substitutes. They were using them for patients who had diabetes, vascularity issues. But the grafts cost thousands of dollars. Really cool regenerative technology, but very expensive, right? And you're using them generally for limb salvage. After I finished with that company, I went and started my own marketing agency. Because of that experience, we were doing a lot in the regenerative medicine space, a lot in wound care, a lot with those bioengineered grafts, very expensive products. And that's when I got introduced to the molecule hypochlorous acid, which is the active ingredient in our product, Active Skin Repair. And it came into the agency, and the medical device company at the time said, hey, we're going to launch this into the hospital space. We'd like your agency's help. And so I started to learn about the science, and the price point was it's very nominal compared to what these other very expensive regenerative products were. And I was like, wow, this is really cool, the safety profile. And I would take samples, and I was using it at that point, I was traveling around, surfing a bunch, avid outdoorsman. I was using it for all these different issues I was getting being outdoors, and it just worked amazing. I watched my friends use it and family members, and I ended up going back to the medical device company and said, hey, this product is amazing. They had an OTC FDA clearance, but we want to focus on the hospital systems, which I got. And I said, any way I could be able to license this technology and launch it over the counter to consumers. I think this is something that should be in everybody's house. And long story short, they agreed. It's a family-run company, so really cool family ran the company, and entrepreneur to entrepreneur, they let me have the license, and we launched in 2017. But really bringing this kind of same medical grade, hospital-based formulation over the counter.
That is really amazing. What's the back? I'd like to know the history of hypochlorous acid. When you heard about it, how long has it been in the hospital setting used? What's the sort of history of its use, I guess, in our healthcare system?
Well, hypochlorous acid, the molecule, it's the same molecule our white blood cells produce. So the molecule, I guess, itself has been around since human history has been around, right?
You're right.
We figured out how to replicate it well over 100 years ago. However, to replicate it, the stability on it wasn't good. So you could only make it bedside. It was very tough to get into the right kind of pH levels, and the shelf life was really, really short. It was in the last about 15 years that the scientists have been able to figure out how to stabilize the molecule, get it into a liquid and a gel formulation. And now we have a 2-year shelf life where you can use it for up to 2 years with the same efficacy. So, and I guess to go back to how the molecule works, so kind of biology 101, if you get cut, scrape, burned, any type of skin damage, your body's natural immune response is going to send white blood cells to that injury. Inside the white blood cells is a molecule called hypochlorous acid. So what we're able to do is replicate that molecule, so you're applying topically the same way your body's working internally.
Amazing.
And it's doing 3 major things. It's a really powerful antimicrobial, so it's killing 99.9% of bacteria, viruses, and fungi within about 15 seconds. It's helping reduce that inflammatory response from the body, and it's going to help speed up that natural healing process.
Amazing. Okay, so you're in that hospital setting, that sort of medical grade setting. When you approached the sort of the manufacturers, the people that are putting it in the hospitals, what you mentioned, entrepreneur, they kind of got it, understood it. So it wasn't like a leap for them to be like, oh, because when you're in the hospital setting, sometimes it's hard to have that sort of vision of like, no, everybody needs to get their hands on this.
Yeah. And I think it was the approach we took was, and the business plan that we decided to go with was not to go into mass retail. So I didn't want to go into the Rite Aids, the Walgreens, the CVS, because if you went in there, we're going to get put in the wound care shelf by nature of how the product works, right? Mm-hmm. Now we can talk about how the molecules evolve, but at that point, it was really much thought of as a wound care product. So we would have been at the back of the store, and that category is so commoditized. It's run by big pharma, the Johnson & Johnsons of the world, and synthetic antibiotics. Our price point would have been higher. So we said, let's really figure out a more niche way to launch this product. And that was really, we started a lot with athletes at the beginning, and then it evolved to really focusing on moms looking for non-toxic solutions. So a way better replacement to a Neosporin, which uses synthetic antibiotics. It's a petroleum-based. There's allergic reactions to it. So, I mean, that product, our product is so superior to something like that we felt like we can do this, but we want to do it in a way that was more targeted and could really explain the kind of full functionality of the product instead of just throwing it on a shelf and hoping it sells.
Yeah. So, I mean, you in effect started a new category, at least a novel idea of using something that was in the hospital system for wound care and using it and translating it in an everyday, everybody needs this use. I imagine that being very difficult of like messaging and educating people about this really unique but unknown compound.
It is. Well, it is. It's incredibly tough because you don't want to sell it like snake oil and say it works on everything. The reality is the product has the same safety profile as saline solution. So unlike synthetic antiseptics like alcohol peroxide, something like that, I can spray it around my eyes, ears, mouth. No toxicity to it, but you have a really powerful antimicrobial that you can use in these sensitive areas. So then you go, okay, think about all the bacterial issues, inflammatory issues that we have on our skin and be able to use a product like that. And so then you go, okay, this is great for if you have little kids. I mean, all the skin issues that a little kid has from, diaper rashes to baby acne to hand, foot, and mouth. You have this really good first line therapy, no toxicity, no allergic reactions, and then all the cuts and scrapes and things that you can replace those synthetic, toxic products with. Yeah.
You mentioned your main fan base are moms looking for non-toxic options for their family. I also have seen hypochlorous acid being really very viral, if for lack of a better word, very trendy, hot right now on social media when it comes to skincare, right? So I know that the way that you formulate the hypochlorous acid with active skin repair is very different than maybe any other things on the market. So can you go into the different, like what should people look out for, I guess would be a good question, on when it comes to the effectiveness and the uniqueness of hypochlorous acid?
Yeah. So I think the molecule itself, I've been doing this now for 10 years. I kind of sing it, the praises. It's such a great molecule. So if you're using it, there's so many different ways to use it. I mean, we call it the WD-40 of skin repair because you can or my big fat Greek wedding, the Windex, right? Like you can use it on everything and everywhere. Yeah. It's really taken off as a facial spray for acne, for post-workouts, as a facial cleanser. And it makes again, you have something really non-toxic that's a good antimicrobial. Makes 100% sense. One of the things that makes us different than 99% of those products that are cosmetics is we actually went through the due diligence. We have a proprietary formulation that we can only own. We went through the due diligence of getting FDA clearance to use on open skin. And so the difference between like a facial spray is it goes under the cosmetic regulations. Anybody that you can use a contract manufacturer, you're not testing it for efficacy, pH levels, things like that. We have to go through the rigor. It's the same process that you would go through to use it in a surgical procedure. So even though ours is over the counter, it is really, really highly tested, high efficacy of the formulation and what it goes through. We test every lot to know that it's going to stay in a really tight pH range, that it's killing the bacteria that we know. So if you are using it on your kids, if you are using it in things like open cuts, you know it's going to be safe and you know it's going to work. Yeah.
So you can have that sort of transparency and confidence on the purity, the effectiveness, the right compounds that you want. Yeah. Is there, as far as the research is concerned, is there an amount that's the best, like a percentage? Like, I guess for other brands out there, I assume some could be kind of diluted, right? Where it's like, it's on the label, but it's not in maybe a therapeutic amount. Is that done in that space? I know it's done in supplement spaces, certainly.
Sure. It's a great question too, because you actually want it to, the amount of hypochlorous in, when you're using it for human skin use. You can also use it for hard surface disinfectant. So you can go up in a much higher percentage for hard surface, but for skin use, you usually want it between about 100 ppm to 250 ppm. And you want to be able to keep it in a pH level of about 4.5 to around 7, in that kind of neutral pH range.
Got it.
That's healthy for skin. The problem that you get is a lot of the stability. If a manufacturer doesn't really understand and doesn't have a good formulation, the stability will change. So when they first manufacture it, it might be at 120 ppm and a 5 pH. What happens, though, is that can change over time. In 6 months, you might have it down to like under a 4 pH, which means you're now acidic, which means it can actually irritate the skin. Yeah. Maybe your parts per million has dropped to 50. And so we test all these different ones that come out, and you do see these huge variations. What makes ours so special and what you get with a medical grade formulation is we know our pH is going to stay in that very safe range for that 2 year. We know the parts per million is going to stay right. So you're gonna, from day 1 to day 700, you're gonna know you're using a product that's efficacious.
That's amazing. Okay, so some things that we see clinically with telehealth patients, I'm gonna go through a few out there, and maybe you can tell me if it's a good, how we would use your products, what would be the protocol for it. You mentioned inflammatory skin issues. We see a lot of that. So people that have acne, how would somebody with acne use active skin repair?
It just becomes a daily. So we have both a spray and a hydrogel, right? And so if you want a kind of more targeted treatment, the hydrogel is great too, because it's more like an ointment, more akin to like what you would expect in Neosporin, but no petroleum, right? So that's great. That's a more targeted treatment that we get a lot of people who, are putting it right onto their acne. You can also use it our spray as a daily facial mist. Especially, it's great on the go stuff when you're trapped. Like, you say you travel a lot. When you're traveling on airplanes and stuff like that, you can spray down your hands and your face.
Yeah.
It was huge when COVID with mask and maskne and stuff like that post-workout. It's a great thing to keep in your bag to help with acne. And it works. I mean, if you go look at the reviews, it works really, really well. And that's why it's a TikTok trend right now, is because of how well it works for acne.
Yeah, got it. So how, for the typical user that has breakouts, has acne breakouts, how fast are people seeing changes? Like, what's that sort of needle moving turning point for them?
I mean, as you know, this acne is anytime you're dealing with bacterial fungal things, it gets so complicated because each individual is unique. And I know by your medical training, you know that there's causes way more than just a bacterial issue, right? I mean, there's hormonal issues. So each person's going to be different. Some people, you notice the difference right away. Sometimes it takes a little bit longer.
Yeah.
The awesome part about this, though, is you can use it, 3-4 times a day too. You're not doing any harm. And in fact, you're from a skin microbiome standpoint, hypochlorous seems to be very selective it's a neutral charge, so it's able to penetrate bad bacteria. So if you have a colonization of bad bacteria, it will kill some of the good bacteria, but at a very kind of low rate. It's very selective to that bad bacteria, so you're able to also really help that skin microbiome get healthy again.
Well, it makes sense because you're mimicking white blood cells, right? And it's like has that sort of molecular mimicry, that intelligence, if you will, to selectively address these opportunistic and pathogenic bacteria. How does it work for, you mentioned the sort of antimicrobial bacterial aspect of it maybe. Does it work similarly for fungal issues? I'm thinking like skin thrush, for example, or candida issues.
It's an antimicrobial, so it's killing fungi. I find the fungus issues are some of the toughest ones to really get a hold of. Here's what I always tell people. This is an amazing, also for things like eczema where you have bacterial colonization. If you're familiar with biofilms too.
Yeah.
So biofilms, you get that extracellular matrix, right? And they create that kind of film to protect that planktonic bacteria. Ours disrupts biofilms. So you're able to disrupt that biofilm and get into that planktonic bacteria. But back to the fungi one, it's tough. I always say it's a great first line therapy before you move to a steroidal. Sometimes you're just going to have to move to something that's a little bit, heavier strength. It has that toxicity, but you have to get it under control.
Yeah.
So it's always what I always tell people is great first line therapy. You're gonna do no harm. If it doesn't, I can't tell you it's going to work for sure. And if it doesn't, then you can move on to kind of a different therapy.
For some people, it's going to be, if I could repeat back, how I would interpret that, it's like for some people is the tool within their toolbox is going to change their skin. For some people, it could be a tool, one of several tools, right? But they may need other things. So that's fascinating with the biofilm. And maybe for people that are newer to the podcast, our approach in functional medicine is an inside out and an outside in, and both and not either or approach. And we're always recommending appropriate skincare products like yours for people that have these inflammatory skin problems. And you're right, there's gut microbiome, gut skin axis issues, or environmental toxins, or nutrient deficiencies, hormone imbalances that we want to look at what's going on. But there's always an outside-in approach to support that skin mantle, to support that skin microbiome, and get that results that people are looking for. So biofilm is something that we see a lot when it comes to the gut, right? And biofilms that impact even the sinus biofilm as well. When you're talking about opportunistic and pathogenic bacteria, virus, mold toxins even. And for people that don't know, what biofilms are, and then as it relates to even our skin on the surface, what role biofilms can play to stubborn skin problems.
Where you really see it too, and a lot of the research is coming out to show with chronic wounds. So when you deal with elderly patients, somebody whose vascularity isn't the same, diabetes. So when you have a diabetic patient and their vascularity isn't as good, especially to lower extremity wounds, what happens is that wound won't heal as fast, right? As we get older, we have vascularity issues. And so the longer that wound stays open, the wound becomes colonized with bacteria, and it actually ends up stalling the healing. And so you can try all these advanced therapies, but if you don't address the biofilm, you're putting something really expensive on without actually addressing this kind of stubborn bacterial colonization that's going to just keep that wound from healing.
Yeah. And for people like there's a lot of internal biofilm disruptors or things that support healthy biofilm, like stevia actually, or stevia, like the plant. People have it in, sweeteners and things, but it's actually therapeutically can be used in its pure form as an internal biofilm disruptor. And there's other xylitol, like it can be a biofilm disruptor. These things, which also why these sweeteners can be disruptive to the gut microbiome when you're using in excess, right? Even these therapeutic things can have digestive problems because it's just overly modulating the gut microbiome and the biofilm too much. I love to hear that you are supporting the skin biofilm in this way with hypochlorous acid. So, okay, so let's go into other inflammatory skin issues. When you talk about, you mentioned eczema, psoriasis even. So what would be a psoriasis protocol? Would it be appropriate for psoriasis?
Sure. And again, I kind of preface it with it's safe to use, right?
Yeah.
So we don't have a medical indication for treating eczema.
Yeah.
But it's safe to use on eczema and psoriasis, especially a lot of the kind of flare-ups that you're going to get. If there's any type of bacterial colonization, right, it's going to work really well to help with that.
Yeah.
But it also helps with like if you have that redness and that itching from eczema or psoriasis, it works really well on that.
Yeah. Okay. Then like the parents, let's just say moms and families, the things that kids have, you mentioned like this cuts and the scrapes. And this is what's so unique about your formula is it's safe for open wounds. It's not something that you need to be afraid with. That's actually what it's really great at, is cleaning up the skin irritation or wound. How much are we supposed to use? If a kid gets scraped, if you have a cut, how much are you using in your natural first aid kit of your product?
I'll take it in a few different ways. Let's start with a diaper rash. So the way that I always recommend it for a diaper rash is, one, it can help if there's a rash there, but it can also help prevent the diaper rash. The rash is coming from bacteria, right? And so it's a great spray, like after you wipe the bottom, to be able to spray it on just to make sure you've got all that bacteria. And then we also recommend, if you have a balm that you use, apply the balm. Hypochlorous acid can be a little drying. So any type of, we always recommend balms or lotions after you use it. The molecule takes about 15 seconds to work. That's what we know. So just give it 15 seconds, and then you can apply a balm or a lotion on top of that.
Got it.
So that's great to help prevent or to also help relieve the symptoms of diaper rash. Something like a cut or a scrape, you can use it 2 to 5 times a day. You can't use it too often. I would say 5 would probably get into the excessive route, that you don't need to be, doing it more than 5 times a day. If my daughter, and if you have a 3-year-old who's, out there playing around, what you want, it's daily issues, right? And she thinks Band-Aids are stickers too. But I'll spray it on, and then we'll put a Band-Aid on it. And then usually in the evening, when we take the Band-Aid off, we'll spray it again.
Amazing.
And again, it's just helping support that healing process and making sure that there's no chance of the bacteria getting in there with an infection.
Got it. What's its use for sunburns, with the time of the year right now, like depending on where you're at in the world, but if you're in the United States, more sun, people are out more. It's the summertime. What's the use there? I mean, how can it be helpful for sunburns?
So that's one of the sunburns and bug bites are one of the ones that people are like, I'm blown away. Like, especially around the bug bite ones, but they're both sunburns and bug bites are inflammatory responses. The sunburns, an inflammatory response to your body getting too much sun, your skin getting too much sun.
Yeah.
The bug bite's an inflammatory reaction to the bug bite from the bug. So it's helping relieve that inflammatory response. And so it works as a great, it's not going to protect you from getting summer. So you need your sunscreens, but I surf. It's just inevitable. Sometimes you get too much sun, even if you've used the best sunscreen in the world and you put it on, sometimes you just get too much sun. And so it just works as a great after sun spray to help reduce that kind of inflammatory, like red skin feeling that you have.
And with bug bites, does it help? I'm assuming with the anti-inflammatory component, the pain or the irritation, the itchiness goes. The itchiness goes
That's
down.
the one.
Yeah.
I really like the hydrogel for that. So our spray and our hydrogel, same active ingredient. The only difference is just form, factor. So it's either in a liquid or a gel. So they're both going to work. The mechanism of action of the molecule works the same.
Yeah.
But I really like the gel to just put on that, and it does help with the itching noticeably right away.
Got it. Well, how about bee stings specifically?
It might help with it if there's an itching component. If there's an abrasion of the skin, it's going to help with that, but it will help with the itchiness.
Yeah, I love it. What is, like, being a dad of a 3-year-old? What are some other things? What are some dad pro tips you're learning in the first years of kids when it comes to healthy skincare?
Yeah. There's a lot of issues is what you end up learning. We've always, my wife and I have always been fans of trying to stay as clean, as close to nature as we can. So, that was one of the reasons I was just really drawn to this product, because it replaced things that were not like that. And I love the multifunctionalness of it. Now my daughter's finally going into potty training, so we've moved past the rashes and stuff from that. But that was we were using it daily like that. A lot of times when you get like some of just the weird everyday bacterial issues like rashes and stuff like that, such a great one. The thing that's great is it doesn't sting as well, and so. What you find is my daughter calls it the boo-boo spray, right? And she likes it. It doesn't bother. It's not like, you remember when you were a kid and you got peroxide put on a cut, you ran from it when you saw your parents. So, but lately too, as we travel more, man, it's just a great thing to have as like a sanitizer. So we get on airplanes, we're spraying my daughter's
That's a good
toys
idea.
down, we spray her hands down, we spray her face down. So you have this kind of non-toxic antiseptic that's going to work, for all the different issues, but it's a great thing to travel with as well.
Yeah. You mentioned the maskne at the height of the pandemic and that being helping with that. Luckily, we don't have, so much of us have that mask anymore. But speaking of traveling, you still see the diehards that they wear the mask still. They if they're getting maskne in 2025, they could use this as well.
Yeah. And again, that's kind of where it's been amazing over the last 5 years to watch the molecule go from like only physicians knew it and like nobody on a consumer side. Now it's, so many people have found out, and I think it was a lot from the acne side of the maskne side of things that it really just caught on through social media. Yeah.
So, that's one way that things have changed over the past 8 years or so that you've been in this industry, or like specifically building this company. What other ways has the company changed? How has it changed over the past 8 years?
The company, we've grown a lot. That's been really fun to watch. We've produced and sold millions of bottles now. And when you do that and you put it into millions of people's hands, the reviews on Amazon, that's one I go out every week and I'll just read the reviews because it's so fun to see how people are using it. Like areas that I never thought of how it could be used, and to hear these people success stories with it. So it's been really cool to just get it into so many people's hands and see all the different ways that that people are using it. The other thing I would say is I've watched so much of consumer awareness change. There's this real kind of movement to non-toxic swaps, which is we've been kind of really along with that ride, and people and moms particularly really taking notice to say, hey, I don't want to accept that because I had Neosporin that's the best product to use. I don't want to accept that, dogmatically what I'm putting on my kids just because it's from a Johnson & Johnson is good, right? And so they're doing more research. Yeah. And again, we've been really part of, being able to be part of that movement and really empowering moms and parents alike to have the research to know that they're using a scientifically backed product. And we're definitely not big pharma. So, that they can support a business that, is run by real people who really care. And, we're also 1% for the Planet Company, so we give back a lot of money to the environment every year. And, just people who are hopefully providing an alternative to kind of the mainstream pharma.
I love it. You mentioned reading the Amazon reviews and being surprised at the different ways that people are using it. What's the most shocking or surprising way that you're like, man, learn something from that Amazon review?
Well, we have to. I mean, we'll get questions in too where I'm like, I got to Google that. I've never heard of that. Oh, that doesn't sound good. You get some of them in sensitive areas of your body that, you wouldn't want to be using a toxic product on.
Right.
It works, really well in some of those types of issues.
So it's safe.
I'll leave it there without getting too graphic.
So in the private areas, sensitive areas, it's good for any inflammatory problem there as well.
Yeah. Razor burns, but also any bacterial issue or anything like that, right? That again.
So this is really opening up. So that's another thing we deal with. You're on the right podcast to talk about this stuff. We normalize this stuff all the time. So a vaginosis, vaginitis, that you're seeing reports of people, you've seen the great success with it there. The things you learn on Amazon reviews,
It
right?
is wild.
Yeah. Where do you see the company going in the future? You kind of seen a lot happening, increased awareness around this amazing product, looking for these non-toxic swaps. Where do you see the future?
Yep. Well, I think there's a lot more future in hypochlorous acid. So we always say that is our anchor product. We are really dedicated to bringing this product and this molecule to the mainstream. And, we're making headway, but there's still a lot of people who don't have it and don't know about it. So that certainly is. But we really want to move into a more robust product line around skin health I'm a huge fan of hyaluronic acid too, right? I like naturally occurring molecules, and I think there's a lot we can do with hyaluronic acid in different products as well. We want to be the awesome thing about hypochlorous acid. There's literally 100+ peer-reviewed scientific articles on how the product works. So we want to keep that really scientific basis on how we think about our active ingredients and use active ingredients. And then the last part is we want to use all clean ingredients. And so we want to formulate products very purposely that address and can work with hypochlorous acid that also provide additional benefits like hydration, like sun protection.
Yeah.
And we're really working hand in hand with the Environmental Working Group, EWG. And so we're putting all of our products through the verification process.
Wow.
And working with their team to, as we formulate products, really thinking mindfully and thoughtfully about what are the ingredients we're using. Are they clinically and scientifically supported?
Yeah.
And are they clean, and will they go through that? And I'm sure you're familiar with EWG. It's a very robust process that you have to go through. And so making sure that not only do they have that scientific evidence, but they fall into that criteria that EWG requires.
What I've heard from friends of mine in the skincare space is EWG is, we've recommended them as a resource for telehealth patients since, the early, 15, 16 years. But what I've heard is from a product development standpoint, it's very difficult. Like they have this massive list of they're the purest of the pure, basically. And Jenny McCarthy is actually who was talking to me about this. Is that she has a makeup line, and to get that stamp of approval from the Environmental Working Group is very difficult. So you're doing the same thing in your line of getting that stamp of approval.
We've got multiple products in review with them right now.
Amazing. It's exciting.
It definitely takes a long time, and but I think it's such for a consumer, and I recommend them so many times. It's EWG Skin Deep database. You can just go in, you can look at specific ingredients. So you type in the ingredient that will give you a ranking from 1 to 10, and you can know where that ingredient, like a hypochlorous acid is a 1. It's and 1 being the best, right? So I can know, okay, I'm using hypochlorous acid. It's a number 1. Great ingredient. And then you can find those problem ingredients. And man, you start to do your due diligence on go into a mainstream CVS and pull out some skincare products. they're in there and they're not great.
Yeah.
And the really cool part is then they'll do the verified product. So they go through and say, hey, everything Active Skin Repair does on this has the EW. They've gone through the due diligence to make sure every ingredient in here fits our criteria and is a 1 or a 2. And yeah, it's just an easy way for consumers to know what they're using is clean.
Yeah, for sure. I recommend anybody listening to this or watching this is to do what Justin said, is to go and look at the products you're using, whether it's makeup, skincare products, anything that you put on your skin, sunscreen, vet what you're using, and you'd be shocked at the individual ingredients that you may not even know because you're not looking at the full label. And they show the research, right? And how much research there is, right? And it's an exhaustive list, really.
And it's a nonprofit too. So, it's unbiased and they're really putting the scientific rigor and not letting it, be commercially swayed.
Yes, exactly. It can't be swayed from corporate, pull. Okay, so non-toxic swaps. So just to be clear on this, and I'd like to maybe go to some other non-toxic swaps that you like, but for people that are looking for non-toxic swaps, what would be the swap? Like they're going to start using Active Skin Repair instead of what can it replace?
Yeah. I think for us right away, the one that I say is clear out that first aid medicine cabinet. I'm somebody who likes simplicity too. So I think a lot of people do.
Yeah.
Get rid of those big bottles of peroxide, of alcohol, of chlorhexidine, or any of those really toxic antiseptics. Neosporin, 100% too. Up to 20% of people have an allergic reaction to Neosporin, specifically neomycin. Yeah, neomycin. Yeah. That's a really easy. You're going to get all that antimicrobial kind of function that you would get in a Neosporin, but without the risk of allergic reaction, without synthetic antibiotics, and without petroleum. So really easy swap right there. Then you can get into again, it's a first line therapy before you jump to something like a steroidal cream. Give our product a shot. Again, you might need to go there, but as a first line, really safe therapy, it might work great on you, and you might not need to be using kind of those toxic products as well.
Yeah.
And then just daily kind of facial care and skin health as a cleanser, it works great as well.
Got it. So this may not be, I don't know if this is like controversial for me to be asking this question, but you mentioned being able, and you sprayed it into your mouth. Can it be used for oral issues as well, oral microbiome and dental mouth inflammatory problems?
The answer is yes. We don't have approval to be using orally, so we're just a topical skin product with our clearance. But there is, if you go into, I love PubMed too, so I'm sure you're very familiar with PubMed. I love to type in and just go in and do my research. And so go in and type in hypochlorous acid in PubMed, and you'll see that there's plenty of articles on how it's being used orally. You'll see, again, biofilms are an issue orally as well. And so you'll watch oral surgeons and dentists use it for procedural. I probably would be pretty hesitant to be using it daily just because you don't want to throw off the good bacteria in there and stuff like that.
Yeah.
But as a surgical or if you're having some type of issue in there, there is evidence or literature that would support that.
Got it. Okay, so in your home, what are some other non-toxic swaps you want people to know about? Instead of whatever they're using, use this instead.
The non-toxic swaps. Well, we're super cognizant now, and this was, again, I've always been inclined to eat organic food, live again as close to nature as possible. But one thing I've been really cognizant of, especially with a young kid and my wife, is the cleaning supplies that we're using.
Right.
So that was we're big fans of Branch Basics. I think our brands have a lot of synergies together.
Yeah, they really do.
And so we're big fans of Branch Basic. I think that's a really easy swap to make. And I think there's, again, I think when you get into stuff that you thought was good or not that bad, it can make a big difference. So that's one, especially, I'm a neat freaks too, so I'm always wiping stuff down. So that was an easy one. Sunscreens, this is a swap I've made a long time ago, but moving away from chemical sunscreens was a big one. It's something I'll never put on my daughter for sure. And using zinc-based sunscreens, mineral-based sunscreens is an easy one. And then on the first aid side, I think if you can move away from your typical Band-Aid to they make really cool wool Band-Aids, bamboo Band-Aids is another good one to do as well.
Love it. Is there any sunscreen that you like the most? Maybe for you surf, for your daughter, for kids?
Yeah, I think there's the Think Sport has Think Baby, Think Sport. It's Think Sunscreen. And I know the guys who started that company, and they were one of the OGs to first bring in zinc sunscreens to the mass market. So because I know them and I've been getting product, I've always been a big fan of their product.
Yeah.
And again, really good sunscreen. And then, I think there's a lot. These days, it's not hard to find good sunscreen. We also have 3 sunscreens in formulation right now.
Oh, exciting.
So I would say our sunscreen, once it can come to market.
Do you know when is it slated to be released?
We'll have our first kind of daily facial sunscreen in June. And then
Amazing.
We're going to be
really right around the corner.
Right around the corner.
Yeah.
And then we're going to be doing a more performance, waterproof one for kind of more outdoor activities, and a stick, which would be great for kids, but for anybody. Probably early next year, we'll have those out. They're all going through EWG, and some of the lotions are easier than the sticks, let me put it that way, to get it through. Figuring out the right formulation and formulating and going through that sunscreen just takes a little while, but we'll have some soon too.
Awesome. So stay tuned, everybody. But yeah, that's another great, EWG, to use it for sunscreen, to vet it. People, honestly, are going to be surprised, I think, with the amount of things that people consume or use on their skin every single day, and they don't even know it. Another swap area that I always like highlighting when I have the chance to do so is kitchen products, like nonstick cookware. Most of them are filled with PFAS, forever chemicals, these Teflon cookware, and make the swap. So that's something I would. What do you guys use in the kitchen? Do you use?
Caraways are.
Oh, yeah. Caraway, Our Place, cast iron skillets, another one, for sure. Another thing I think about, is our air fresheners, right? When you came here at an Uber probably, or to take Ubers when you're traveling, isn't it the worst when you get into an Uber or a Lyft and it's like the worst synthetic fragrance car freshener, and they think they're doing you a favor, but it makes me nauseous.
It's funny, once you move away, we moved away from fragrance stuff. And you'll never see any of our skin products have any type of added fragrance. But even in the household thing with the Febrezes of the, when you get away from it and then you smell it, you're like, whoa, that is overwhelming smell.
Yeah. I know. My wife and I we were in Orlando. We spoke at a homeschooling conference last week, and we said there should be a setting on Uber or Lyft to say no air freshener. Please. They ask about the temperature, but not car freshener. No, it's not going to work. I want to reach out in reach to the front of the car and throw it out the window, but I won't do it. I'll be a nice. I want my Uber rating to be not dinged. That would be a bad one. My friend, before you go, the podcast is called The Art of Being Well. At the end of every episode, we have Your Art of Being Well. What is the worst tasting healthy food that you eat? It tastes freaking disgusting, but you do it for the health sciences of it, the health benefits.
Kale.
Got it. So how do you have the kale?
Well, just kale as its own in the salad. Is not my favorite.
Oh no, it's not. It's an acquired taste.
So what I put it in smoothies. That's kind of been because I know it's just nutrient rich. I really can appreciate the value or the nutritional value it has, but it's so easy. Once you put it in a smoothie, especially if I put some pineapple in with it and a little coconut water, and it just,
Having another little kale tip, if someone wants to have it, is cooking it down, right? It breaks down some of the oxalates. These are plant nutrients. Even in soups and stews can be great because you can kind of get that fiber and the nutrition, but actually make it more bioavailable when the sort of plant defense mechanisms are lessened with cooking it down. All right. Do you take supplements? And if so, what are 2 supplements that have been maybe lesser known, people may be surprised or should learn about that have been supportive for you?
The only supplement I'm taking right now is AG1. So
Interesting.
I take it every morning. I've used other supplements, but that I would love to. I've been listening to your podcast and thinking I should run my labs.
Yeah, let's do
and
it, man.
see
We'll have you back and we'll go over your labs in front of everybody.
where I might be deficient on some of it. But I think AG1 does an amazing job marketing too. And I think they got me.
They got you. Well, because you listen to the podcast.
I will tell you, it's not the greatest. In my opinion, it's not the greatest tasting. I just kind of chug it down first thing in the morning. But it's my daily.
I don't mind the taste. Yeah, but to each its own. But yeah, they've been a sponsor of the podcast since day one because it's a great. They've kind of mastered. You're right, like the foundational nutrition, filling in the gaps of the most common ones. So great, you got your all-in-one AG1. What is a place that you've traveled to that should be on other people's bucket list?
I had a good run. I went to about 50 different countries.
Wow.
So I could talk for another hour on that one. One of my favorite spots in the world is Portugal. And not just Lisbon. Lisbon's an amazing town, but go into some of the little surfer towns like Ericeira and stuff like that. And the people are great. The food is fantastic, and it's not expensive.
Wow. What's somewhere you've been to out of those 50 plus countries that you would never go to again that wasn't worth it? Or one and done, right? Maybe you can appreciate it, but it's like there's no eagerness to go back.
I went to Albania, and I was meeting somebody who was writing a novel on a character she was basing out of Albania, and so it was kind of really cool to go around there. But I wouldn't go back. It wouldn't be a place that I would say, "Oh, you should go if you got a 2-week vacation. Go to Albania." Like it wouldn't be top of my list.
Oh, all the Albanians out there, right? I know a few. We love you. We love you. What is someplace you haven't been to that you want to make it to?
There's a lot there too. We've been going back and forth, my wife, and now with a 3-year-old, how much is our threshold to travel overseas with her? On the low list, I've never been up into the Nordic region of Europe, so I'm super interested to go to Finland and Sweden and areas like that. I love the design of their, that they have, and it just seems like really cool areas to visit. So I would say that's top on the list, right?
Yeah. What's the weirdest or more like most out of the box or controversial thing you've done for your wellness that you're willing to admit on a podcast?
It was controversial.
Or weird. I mean,
okay, I'll give you a weird. I ran barefoot. That was my thing. So I would run barefoot. I actually ran a marathon barefoot.
Wow.
So definitely get some looks. You definitely get looks when you're running on the road barefoot. So
what, were you the only one doing this? What's the backstory of it?
So I had IT band issues, and I love to run, but my IT band would just keep locking up on me once I get to like mile 4 or 5. And I started to do some research, and there was this whole barefoot running kind of movement. And when I started to run barefoot, I noticed it kept me up on the balls of my feet more, and it kept me shorter strides. And you just kind of run more more naturally than you do in a cushioned shoe. And it took away the IT band issues. And then I really started to love. I live by the ocean, so I'd start running on the ocean barefoot, and just love the connection to nature. And it's weird. People don't always, you get some weird looks, but I enjoy it.
Yeah. And we talk a lot about on the podcast about grounding and kind of getting your feet on the ground, which I highly recommend, but you have to be probably careful when you're running a marathon and like what you're stepping over, right?
And it was San Francisco Marathon, so
oh my gosh,
a lot of hills over the Golden Gate Bridge, and they were bloody when it was done. I wouldn't do it again.
Gosh, don't do that. Don't do that. I'm thinking broken glass, needles, San Francisco, baby. Watch out. But yeah, hey, look, you did it. Have you ever tried those shoes with like the toes, like the barefoot? Are you a fan of those?
I started. They get so stinky.
Really?
Yeah, so I
Okay.
always just had a problem. Like when I get to hotel rooms, I'd have to like hang them outside the
my
window
gosh.
because
Yeah.
they'd smell. So
They need to
then I just went
improve the
complete barefoot.
breathability
But
of
that's
it.
actually where I started, is with those 5-finger shoes.
Got it. What's maybe something a common question that I get from people listening to the podcast is they want to know what the guests' top tips are for a great night's sleep. What do you do for a great night's sleep?
That's my constant trying to figure out
Yeah, 3-year-old, I don't know where you're at on that sort of cycle, but
So one for me is I drink alcohol, and I notice my sleep is so much worse when I've had a little wine or beer or something like that. So the thing that I know is if I can eliminate alcohol,
Yeah.
which, it's still going to be part of my life, but man, my sleep is so much better. I personally, like when I got into my hotel room, I kick it down to like 63 degrees.
yes, that's the move.
I like cold, and
I think the research is 63 to 67, around there. Don't quote me, but around that ballpark Fahrenheit for the best night's sleep.
So what do you? I mean, that's a subject that I could again research all day, because sleep is so important.
Not drinking alcohol is a good one. I think you're onto something with that one for sure. But yeah, temperature is great. Like blackout, like make it as dark as you can.
Yeah.
Weighted blanket can be good as long as it's not overheating you. Magnesium could be great at night. Blue light blocking glasses. I have these on now when I'm recording.
I've tried the magnesium too. Yeah.
Yeah. All good tips. Go tips. What's your bet? Like from a traveling standpoint, you've traveled all these countries. What's the best thing that you do personally to beat jet lag? Any pro tips?
I do use melatonin. I do think it works. I don't use melatonin nightly, but especially if I'm jumping time zone, I do think it helps me kind of get back onto that right rhythm.
Yeah.
In terms of jet lag, I'm also I'd be interested in knowing what hydration powder you recommend.
Yeah.
I think I've heard Element.
Element's been a podcast sponsor for a long time.
But
we use them clinically. We recommend them clinically, yeah.
Hydration is I think it's so easy to stop. Like, I'm so good if I'm at the gym to make sure I drink water during the day, but when I travel and I'm on airplanes, you get the little cup of water that they come around every 4 hours with. I always just try to make sure I get a good bottle of water, and I'll use some hydration powder and just try and stay hydrated.
Yeah. What's your favorite form of exercise? Is it running? I mean, what's your go-to exercise these days?
No, surfing and yoga.
Surfing, right?
Surfing. If I can be in the water, it doesn't feel like exercise. So I always think it's funny when I say it's exercise, but it's amazing exercise. So
for sure.
Being in the ocean, even if there's not great waves, just paddling around and having that kind of connection with nature is always good, both mentally and physically.
Yeah, 100%. And you mentioned yoga. What's your go-to? What's your yoga style of choice?
A vinyasa
like a
flow.
Yeah.
And that's, again, like you add in the meditation to that, and it has that kind of physical but also mental benefit too. And running does too for me. I find, especially when you get past a few miles, that your mind stops, racing, and all of a sudden when you run barefoot, you have to also watch where your feet are hitting each time. So you find into this like really meditative trance, which was another reason why I liked being barefoot too.
Yeah. What is a book that you've read? It could be fiction, nonfiction, that just I should add to the Art of Being Well book club. That we have to launch one of these days, guys. I have a massive list. So what should I add to the list?
Oh, God. I've been reading a lot of fiction lately. The one I was reading on the way here, I don't think I put on your book list. It's just like kind of one of those summer reads. It's called The Silent Patient, but man, it makes you turn the pages. It was good.
What's it about?
It's somebody, a woman who commits murder and then doesn't talk.
And
it just has you kind of guessing.
Yeah,
all the way
my
to the
wife
end.
would like that. She likes things that scare her, and then she can't sleep.
And I was reading some like heavier nonfiction and literature before, and there's just one of those ones where you're like, well, I just read 100 pages and didn't even think about it. It's like that one where I just kind of, it's like such an easy kind of beach read. So that would be my beach read. The other one I just read, and I know it's older, but it's Breath or Breathe.
Yeah.
And It was one that I got recommended it, and I was like, I'm not sure I want to read a whole book on breathing. And it blew my mind. Nose breathing, like talk about sleeping at night.
Yeah.
I started to become super cognizant of when I'm like, don't breathe out of my nose, and how much better my sleep is if I can breathe. I haven't gone into the mouth tape yet, but my sleep is so much better if I can breathe out of my nose.
Yeah, 100%. No, I mean, you talk about sleep pro tips, mouth tape. I have seen it in countless telehealth patients. Mouth taping being a significant needle mover for improving REM and deep sleep.
Yeah.
Without a doubt. You should make the move. Try it out.
Yeah, I know. And you can tell, like, when I'm breathing a lot through my mouth, I'll be thirsty all night. And when I have like a better night's sleep, that I can tell is like I'm breathing through my nose, I don't have that like constant thirst. So
So cool.
I love that book. I'd highly recommend. It is amazingly entertaining for all being about breathing.
Amazing. Justin, where do people go to learn about the amazing things we talked about today?
So website is great, activeskinrepair.com. All that information about the product is there, ability to buy the product. We also have an Instagram that we have a constantly updating. I have a great group of people who post for us through that, and that's just at Active Skin Repair. And yeah, I would say Instagram or website.
Amazing, Justin. I'll put that all in the show notes, guys. So just go to drwillcole.com, go to podcasts. We'll put it there. And it's also on Apple Podcasts and Spotify, depending on where you listen to the pod, man. Thanks for coming out here. I appreciate it.
Thank you so much for having me. I'd add one more thing, too.
Yeah.
Hello at BLDG Active, which will be on our website, too. Anytime anybody has any questions or wants to know, how the product works or what it might work on, reach out. We're super quick to answer.
You said hello at
BLDGactive.com.
Amazing, Justin. Thanks for coming out.
Thank you.